You heard, my name is Janelle Falcon. I am a Cuban American, emphasis on the Cuban piece, really, because I was born and raised in South Florida with all the culture, the traditions, especially the food, and I really wouldn't have it any other way. I do come from an immigrant family where I grew up speaking Spanish first and foremost. Eventually, the English kind of came around, but Spanish was first. We spoke Spanish at home. And to this day, with some family members, Spanish is the only way to communicate. Um, I'm a tia, a very proud tia to a niece and a nephew. I'm a daughter, a granddaughter, a friend, a partner. I'm also a business owner, a community member. So as you see and as you hear, I'm just another human trying to navigate life like everyone else, right? I think that's the most important piece to emphasize here because we're all in this together, right? Now, professionally, yes, I'm a therapist, a licensed psychotherapist. You see all the letters, and I kind of broke it down. I'm a licensed marriage family therapist. It's a tongue twister, licensed mental health counselor, and a nationally certified counselor. But all that to say is that I like to hear people's stories. I like to hear where they come from. I like to understand where they want to go and help them try and get there to live their most authentic lives. And really part of that is understanding where they came from in terms of what did they learn about certain messages they got within their childhood about strength, resilience, family, what we do or what we don't do when life gets hard, and how we can shift some of those things kind of just going forward. So we're gonna have a bit of that conversation today. Like I was mentioning to Keely and Jasmine earlier, I really don't like to just lecture and talk at people. I would really love to just have this conversation all together. So with that being said, I'm gonna start off with asking you all a question, which is when you hear the words mental health, what comes to your mind? It could be a word, it could be a phrase, it could be anything. And you can either feel free to put it in the chat, you could say it out loud. There's nothing that's going to offend me in the sense that, like, it doesn't have to be a positive word. It's okay. That's actually why we're having this conversation today. So don't stress there.
Anxiety.
Okay, so someone's immediately saying anxiety. I see stress in the chat. Somebody's saying therapy. Another person is saying tired. Sure. All these are really common words when we're thinking about mental health. All right, I'll see if there's any others. I'll tell you what has come to mind. Oh, somebody's saying peace of mind, somebody is saying the brain, beautiful, mental wellness. All right, so we're kind of seeing a mix of things. We're kind of seeing like the stressful words, as well as some of the more positive words. We see balance and well-being. I'll throw out maybe some of the words that people think of, but are not necessarily saying. So crazy, weakness, right? I know that that's a big one, especially coming from my background, right? We heard a lot of that talk. I can imagine I'm the only one when somebody was maybe acting out of sorts, and I'll use those words in air quotes, where somebody was saying, "Oh my God, look at this person," or are they being a little crazy? Maybe they need help. They need to go somewhere and see someone. And so the reason why I'm asking this question is at the end of the day, there's no wrong answers when it comes to mental health. Everybody's going to show up differently. Everybody's going to think of mental health in very different ways, not only in terms of how they're learning about it today, but also how they learned about it throughout their childhood, and even how they have those conversations currently today with their family, right? And it also shows us that we all have a relationship with mental health whether we think about it or not on a conscious level, but it's still there, right? So when we think about mental health, it's not just simply the absence of mental illness itself. It's really the ability to cope with stress, build those relationships, be productive in a society, and being able to contribute to community as well. So I like to think of it more as this continuum. We have the healthy side of things, and then we have the side of things where then we feel ill, and we can think of it the same way as we think of physical health, right? Some days we're healthier, some days we feel sicker, and then there's everything that kind of happens in between too. So if we think about mental health that way, then we realize we all have mental health. So think about mental health almost like blood pressure. You don't just wake up one morning and have a blood pressure. You have blood pressure every single day. It's just going to change depending on if you slept well or not, if you're feeling stressed, depending on your genetics, even your exercise. Life events will definitely do a number on blood pressure. So mental health works the exact same way, and we're going to see how different factors will also impact mental health based on what's going on, or even just based on history. So I want to say this, but with a caveat, don't make any judgments just yet, right? Um, at the end of the day, mental health does not discriminate. Right, so you see the face here, and this could be any one of us sitting on this call today. Mental health does not discriminate in the sense that any one of us can be impacted by a mental health condition all the same. It doesn't care about our professions, it doesn't care about our walks of life, it doesn't care about our tax brackets, who we know, what we know. It doesn't matter. However, and this is the really important piece in the conversation we're having today, is the outcomes will be driven by our lived experiences and our social conditions. And there is no way to ignore that, right? The condition can exist within anybody, but the outcomes will be dependent on how we essentially experience life and how we show up in life. There's no doubt there. And the research proves it. This isn't just me making it up based on anecdotal evidence and me, being in the clinical world and all of that. There's decades of research to prove it based on social determinants of health. So how a person's journey with mental health it exists will impact them subsequently and their outcomes. So there's different social determinants of health. What that means is that people do research. So things like the APA, which is the American Psychological Association. We have the National Institute of Mental Health. We have SAMHSA, which is substance abuse. They all look into social determinants of health, meaning that they look into social factors that we know are going to impact different people in different areas of their life. And so what we know is that when it comes to mental health, essentially, things like discrimination are going to have horrible impacts on somebody's mental health. We know that chronic stress will do the same. Economic inequality, neighborhood environments, access to care, things like insurance, which are going to make things difficult, historical mistrust as well, and exposure to trauma. And so, why is this even relevant? Because when we're talking about minority populations, and specifically the Black population, then we're already looking at a lot of these areas. We're looking at historical mistrust. There's a lot of exposure to trauma, and if not generational trauma. And there's no way to then have this conversation without talking about discrimination as well. And so that already increases the risk for mental health conditions itself. And then we know that the outcomes then aren't going to be as positive as the next person, right? So again, mental health itself does not discriminate. However, the outcomes will, depending on the factors that somebody is being exposed to. So to kind of help this make sense a little bit, and I know this sounds a little bit elementary, think of, carrying some sort of backpack, but we all start off at a different starting point. There's no way to ignore that too, right? Sometimes people are gonna have this brand new backpack. It's beautiful. Sometimes people are gonna have a worn down one. Sometimes people are gonna have an empty one, a light one almost half full, or maybe, yeah, filled to the brim. And then we have to understand what starts to go into that backpack, whether it's financial stressors, whether it's discrimination for caregivers as well. That's something tremendous to carry. Different health conditions, then it's access to care for those conditions, whether it's grief, whether it's food insecurity, whether it is that generational trauma, etc. As we keep packing it all into that backpack, then we understand that that backpack is getting pretty heavy overall. And it's not the initial weight of that backpack that we have to be concerned about. It's the day to day that then starts to weigh on us. So it's not about the brute strength initially, about taking on all of these things. It's about how we have to be concerned that there's going to be some days that this backpack is going to take more from you in terms of effort, energy, um, emotional well-being. But there's also going to be days that that backpack doesn't have any more space, and yet life continues to happen, and you need to somehow create space. But at some point, that backpack will fall apart. It can only hold so much weight, and you can only hold so much weight carrying that backpack too. So at what point do you recognize, wait a second, I need some support. I need to put this backpack down. I need to ask someone else maybe to carry a few things here to help me get through these things because this backpack is way too heavy. I've been carrying it alone for way too long, and I need to be able to manage some of these things. And so it goes back to this research that's showing, again, the outcomes. We've talked about some specifically already, but then specifically when it comes to discrimination, it's associated with already higher risks of things like depression, anxiety, distress, and just physical health over time. There's not just even thinking about mental health as it is, but also thinking about who we are and our medical health and our physical health. We will wear down over time. So within all of that and understanding all the social determinants of health, we can start to become more aware. Um, but we also have to have this conversation about stigma. I know I'm not the only one coming from a Cuban family, and I've heard lots of things, and now I'm the outlier becoming the therapist talking about feelings and other things you're not supposed to talk about outside the house. Um, and so when it comes to stigma, essentially what it's doing is perpetuating all the systems that have been put into place, and we're not necessarily doing something about it. So I'm sure you've heard a lot of comments, and if any come to mind, put them in the chat too. But I'm gonna throw some here, some up here on the screen to see how you relate to them. And I'm also gonna share one initially that is big in our community, right? The Hispanic one. So the first one being is los trapos sucios se lavan en casa. What essentially that means is you don't wash your dirty linen in public, right? So, it's kind of like Vegas rules. What happens in Vegas stays in Vegas. Well, what happens in the house stays in this house. So essentially what we're doing is maintaining that sense of secrecy and that shame. And it continues to breed because we're refusing to have these conversations, whether it's at home or whether it's openly, because now we're asking from support or for support from people like our friends or from our community or from our professionals, so that we can help manage some of these. I, and if we don't even say conditions, it's just life, right? So forget the fact that maybe there's a label to explain some of these things. Well, we'll just say feelings, right? And so there's help available to us, but because this has been harped on for so long and we've heard it from being a child or whatever it is, then we refuse to talk about it because it's been drilled in us that we can't talk about these outside of the home. We can talk about it at home. But then think about it honestly. How often are you actually having these conversations at home because it's really uncomfortable to do so? Because you know what? Actually, we just got to carry on and just move on with life. Just deal with it, right? So, another common one is pray about it. So, what's actually being suggested is, well, we don't have these conversations outside of the house. But what you actually can do is have the conversation with your higher being, right? So you can have this conversation with your higher being, which I'm not shading that whatsoever. Um, Praying is a very powerful thing, especially when it comes to mental health. However, pray to God, but we're still not going to talk about it. We're still going to ignore it. We're still going to keep the secrets. We're still going to breed the shame. And at some point, it even becomes a sense of guilt as well, because we're still not allowed to talk about it. I see somebody's mentioning, yeah, many times we didn't talk about it at home either. Of course, right? So we didn't get to talk about it outside the house. We don't get to talk about it at home, but we have this one source that we can talk about it. And so now we're just kind of bottling all these things up inside, inside, inside. And likely we're not necessarily seeing the results or the resolve that we're looking for. We'll hear a lot of the comments, things like handle your business. Like, you know what? I keep hearing these comments or these complaints. I actually don't want to listen to this. Just go do what you gotta do and don't tell me anything else. Again, goes back to some of that secrecy, or for some people, it can feel invalidating, like, oh man, like this person really just doesn't care. And so, why should I bother to take up space? Why should I bother to take up time? Why should I bother to do any of this at this time? So you gotta do something else. Yes. So somebody's mentioning, yeah, so welcome to my community, pray to God. And they're mentioning too, or blame the behaviors on the devil. That's a really common thing across a lot of communities. So we see it a lot too in the Hispanic community, believe it or not. And obviously seeing that you see it in your community. I've had a lot of conversations, and believe it or not, there's a lot of overlap between Black communities and Hispanic communities. And it's interesting to see. But yeah, so when somebody starts struggling in any way, shape, or form, and it can be explained by something like a mental health condition, there are a lot of people that will then jump on and say, okay, well, actually, it might be the devil. There might be a possession here. We need to find an exorcism, which can be dangerous in some ways. And I'm not going to discount it completely, because our culture is there for a reason. They're trying to explain something. We understand that. And it can do a lot of damage to that person, in the sense that those conversations or those experiences themselves can increase the symptoms and make it worse. And in addition to that, it's going to be harder for them to speak up next time when they need the help, whether it's from their family or from a religious leader, whoever else, because they just went through this. For some people, it could be a traumatic experience. And so, why do they want to do that again? Why do they want to put themselves in a really tough situation to potentially face this traumatic situation again? And for that, they just, again, keep quiet and carry on. So they're still finding the situation in which they can't speak and find a solution and feel better. We've also heard things like, you're stronger than that, and even someone else has it worse. Immediately putting a person down and saying, you know what? It's not worth it to complain right now, or it's not worth it to even think about it. Just figure it out, because, didn't you remember how this other person has cancer? They're really struggling. Or don't you remember how there's little kids struggling on the other side of the world? Yeah. And what that's going to do in that moment is discredit your own suffering. And so That's a wonderful comment. I'll get to it now. And so it's not to diminish anybody else's struggle in life. What we're saying is that there's an opportunity to acknowledge struggle all around. Somebody else can be struggling and you can be struggling too, and we don't need to compare the two. So both things can be true at once. You can be struggling just as much as the next person, and that's just as important. And we can still offer that support that someone needs. So somebody is mentioning, I'm pleased to see that some churches have begun to see that sometimes we need more than prayer. And yeah, that is a beautiful thing. I think that churches in some ways are evolving and having larger conversations, even sometimes when it comes to things like mental health, it is a beautiful thing. Instead of sometimes having explanations for mental health symptoms that are more religious, I guess, in nature. And then one, I've honestly heard it a lot in Spanish, and you guys can tell me if you've heard it too, is nobody's got time to be depressed. Nobody's got time to be anxious. Nobody's got time for this or that or whatever. I can't tell you how many times I've heard it, right? It's just like, well, there's no time. You gotta just move on. Get to the next thing and be efficient and be productive and keep it moving, right? And that's just, excuse me, 6 examples. Not to mention comments, things like man up or you're just being lazy. It is what it is. In Spanish, we have eso es cosa de loco. That's just the things that crazy people do. We have échale ganas, which is just, oh, you gotta try harder. We have ponte las pilas. I know these things sound funny. With ponte las pilas, direct a translation would be like put on your batteries, but loosely it's like get it together and keep it moving. So we have all these sayings for a reason, and they come from somewhere, which is essentially keep it moving, be resilient, and we gotta go. Um, What are primary caregivers doing to address the barriers that contribute to mental health disparities in minority communities? Primary caregivers in the sense of like people caring for someone is sick, or a just clarify, I guess, who would be the primary caregiver?
So that was me. So I'm talking about your general practitioner. Typically
Oh,
that's
the
the
general practitioner?
thing,
Yeah.
right, before you see specialists.
So right now there's a big push actually, for general practitioners. So if you're seeing like your primary care, your internal medicine doctor, your family medicine doctor, um, what they are meant to do, based on current standards, is to ask the patient. So if you go in, it would be you to complete certain assessments. The one that I think right now is the one they're meant to complete for sure is the PHQ-9. So PHQ-9 is a assessment, and it's a brief assessment. It's 9 questions on depression, right? Now, some practitioners feel a lot more comfortable having that a conversation than others, right? Because it does ask about suicidality. It asks about how often a person is feeling sad. So somebody's saying their doctor does it. That's fantastic. Because if you score high, then what happens is you're supposed to have a conversation, right? And so some doctors are like, oh, okay, well, are you feeling sad? And if a person just says no, then they discredit the PHQ-9 versus if a person actually has a conversation, they're paying attention to it, the primary care physician can then, make a referral to, let's say, the relevant expert. So it could be a psychiatrist, it could be a therapist, it could be whoever. But the primary care needs to look out for it because oftentimes a client, a patient, whatever we want to call a person, is going to see primary care way before they see an actual professional in the field. And to be honest, this is one of the best touch points because oftentimes, or not oftentimes, research shows that it takes people about 11 years from an initial onset, any sort of symptom appearing, to then actually seeing a professional within the mental health world. So if we can get them or actually identify them within the primary care office, then that's the most ideal thing to really shorten that 11-year, I guess, wait time, if you want to call it that. The other thing that some doctors are doing more, and there's a bigger push for it, is also the GAD. I think it's the GAD-7, if I'm not mistaken. And the GAD-7, what it does is it measures for anxiety. Again, a few short questions, and then the doctor can have more of a conversation around it. So we have a few doctors, it seems, that do it. Fantastic. They do it as a professional. And we're also seeing more doctors that, yes, they'll do the assessments, but they're also assessing for symptoms outside of some of these assessments, in the sense that, there's symptoms that are very common. We're all going to experience on a day-to-day basis. Things like feeling tired, things like not sleeping well, our appetite, weight gain, weight loss, general stressors, general anxiety. And if they start to notice some of these patterns, or they can explain somebody's physical symptoms through a medical condition, then they'll kind of connect the dots and say, wait a second, maybe are you experiencing something emotionally? Let's get you to the right person as well. So some people are getting a little bit more savvy, I would say, within having some of these conversations. They're not required by law by any means. They could be optional. It's a big push, more so coming from these like medical communities, more so as a standard practice, right? Just so that we can capture the people that truly need the help, and so they don't fall behind. Yeah. And so talking about some of these stigmas, right, that even falls into the medical community. Some people are scared to have that conversation. Some people don't know how to have that conversation. And truth be told, and I'm sure you all are aware, is some people are scared to answer some of these assessments because, rightfully so, there's a lot of mistrust within the medical community. And on the other side of it, too, some people that are physicians, right, can be biased, can, they will interpret things in a lot of different ways. So that's important to know as well. So seeing somebody that you actually trust is going to be incredibly important when it comes to some of these situations. Now, when it comes to stigma, yes, we've noticed how these messages have helped previous generations, instead of focusing necessarily on the negative side of it. It's come from a place of survival, right? It helped all these generations survive certain environments and certain situations where they were vulnerable or they weren't always safe. But like I've said many, many times throughout this, is it can be invalidating to who we are today, right? It's gonna foster those expectations that we're just meant to manage life by ourselves and just grit and bear it and white knuckle it, right? It's gonna continue to breed that shame and that secrecy, sometimes even in dangerous situations, and it can add that guilt too. So we don't want to continue normalizing these experiences any further by perpetuating that stigma that already exists. We want to kind of break that pattern, if you will. Now, I don't want to ignorantly say that things are 100% better and we just ignore these things completely, because that would be far from the truth. But hopefully through this conversation, we can all walk away a little bit more informed, empowered, and with some resources that I'll offer as well. And I know we've been talking about some of the downfalls, if you will, in terms of previous generations and how they've had these conversations around mental health, but we also have to acknowledge all the resilience, right? Because as much as we've inherited struggles, if you will, because it does get passed down generationally, we've also inherited strength and resilience through our families and through our loved ones. And so we know that there's a lot of factors that become protective within certain situations that have helped us, right, live through some of those comments where we've been able to show up and kind of grit and bear it, or we've been able to show up and just ignore some of these stressors and move through it, or we've been able to turn to faith itself and lean on that during these difficult times. So within that, there's been a lot of positive. So how can we still lean towards some of these factors that help us be extremely resilient while still choosing to do something a little bit differently, and not turn a blind eye towards the fact that no, we don't have to normalize some of these behaviors. So what can we do? Because I know we've talked about a lot of things that feel probably a little bit helpless, and I don't want to leave you all feeling that way throughout this conversation. So we're going to talk about what we can do individually within our families and even in our workplaces, right? Because we also have to model this behavior. So personally, on an individual level, starting with just checking in with yourself, having that honest to God conversation with yourself. So you can ask yourself, how am I feeling? And people tend to have a really difficult time responding honestly to this question, right? Because people will just say, I'm good, I'm a little tired, or I'm fine. But if you're actually honest with yourself, are you able to acknowledge that you're feeling anxious? Are you feeling sad for more than one day? Are you laying in bed for multiple days at a time? What is it that's actually going on with you? And can you acknowledge that? So then you can acknowledge what comes next. What is it that you need based on how you've been feeling? That's going to be very important. Focusing on routine as well. There we go. Focusing on routine is going to be a big thing too, because although most of you, from what I understand, are business owners or are in business in some way, shape, or form, and it requires a lot of time, energy, and effort, routine tends to be one of the first things that falls by the wayside, right? When it comes to stress, when it comes to anxiety, depression, really any sort of mental health conditions or just symptoms. We don't have to label it, right? So focusing on the fact that you need to feed yourself, you need to nourish and fuel your body. And it's just not like snacks here and there, and those are great, but actually sitting down and having full meals to make sure that you're sustaining yourself not only mentally and emotionally, but physically as well. If not, you will wear down one way or another. Continuing to hydrate yourself, getting enough sleep. And I don't mean just, 3 or 4 hours, and that's nice. No, making sure you're getting the 7 to 8 hours. I know that feels impossible for some, but that's most important because of the mental health benefits. But if we leave that, alone for a moment, there's so many physical health risks if we don't get enough sleep. We're talking about things like obesity. We're talking cardiovascular health disease. We're talking about diabetes. Like there's so many risks. So if you don't want to pay attention to the mental health side of it, at least pay attention to the physical health side of it and the risks associated with not sleeping enough. There's also movement as well. Again, I know that you're busy. I promise. And one of the first things I always ask people is, do you move in any way, shape, or form? Because I don't really care if you do strength training, if you're a runner, if you're a swimmer, it doesn't matter. The point is that we know that movement in any way, shape, or form, hopefully enjoyable movement, is going to help reduce symptoms of anxiety, depression. It's going to help tremendously with stress levels as well. And it's going to protect your body from all those physical health risks too. And connection. Connection, we harp on this so much within mental health, but connection is protection. Think about that for just a moment. Connection is protection. It protects you from not only mental health conditions, and I know I keep sounding like a broken record here, but physical health conditions too. There's now research to show that loneliness itself is equivalent to smoking, I think it's like 17 cigarettes a day. So it has harsh risks on our body physically, but we know that connection is going to help foster a sense of resilience as well. And it's going to serve a purpose because it drives us and it gives us hope. So in those moments that you're needing that support, connecting with people, asking for that help, socializing, and within those conversations itself, you start to realize, wait a second, I'm not alone in this. I'm not the only one that's feeling so stressed, so anxious. And there's a lot there that becomes powerful itself because you move from isolation to realizing I can ask for help, it's okay, to then realizing, wait, people will show up for me. And last but not least, and I leave it last because this can be more difficult for some people, is asking for that professional support when you need it. Somebody's mentioning routine is definitely on my to-do list, both morning and evening. Yes, so having that wind down routine is so important too. You're a step ahead. Um, Lots of social groups are forming. Beautiful that you mentioned it. Um, it's just based on shared interest and no pressure. I love that you shared that because it's true. Now you can just go online and say, I love to talk about, I don't know, trees, and you'll find a group on that. I love to play pickleball. You'll find a group on that. And there's no real pressure or commitment like you're mentioning. It's just a matter of finding a group of like-minded individuals. And that's really cool in and of itself. You get to make new friends. Oh, how do you find a psychotherapist that fits you? I'm going to share that in just a moment. I think it might be the next slide. And we have a lot of resources for you all. So within families as well, what can you do? So if you have kids or not, it doesn't matter. It's just a matter of the people that you surround yourself with, really. It could be your friends, it could be anyone. Um, so being able to talk openly, right? Being intentional in those conversations, getting to actually know the people around you. So you can start to notice when things are a little bit off and they're showing up a little bit differently and asking how they're actually doing. It's not just a, hey, how are you? Oh, you're good. Okay, move on. No, like, how are you actually doing? What's going on in life? And having those conversations, um, avoiding that shame and judgment throughout those conversations because hey, as a human, I don't want to be shamed. I don't want to be judged. That's not going to make me want to talk to you more. And I imagine all of us feel similarly here. So trying to avoid that. And so within that, you're modeling a behavior and emotions, especially. So if you have kids around you often, doesn't matter if they're your kids, if you have nieces, nephews, grandchildren, whatever it is, right? It's modeling these experiences for them because the best thing that you can do is teach them as early as possible, right? Because they learn by example. There's, I mean, that's the only way they learn. They don't understand the do this, but then, an adult is going to do differently. That becomes a conflict for them. And at their age, they can't understand that. So whatever you do, they're going to do. If they see you saying, I'm sad, they will learn how to connect that for themselves as well. If they see you saying, I'm happy, they will do the same too, just as well as being able to normalize asking for help. So if you ask them, hey, can I get some help picking this up? They will learn, even if it's just as simple as picking up a piece of trash, they will learn it's okay to ask for help. And in workplaces, because at the end of the day, it's not just a personal issue, it's also a leadership issue. We have to normalize some of those mental health days. People do need breaks. And for what might be stressful for me is not necessarily stressful for you. Offer some of that EAP information, that flexible scheduling, create that safety to have those hard conversations, those how are you conversations, and being able to lead by example. Now, I know that I have 2 minutes left and I will quickly run through this because I'll put up the resources after. At the end of the day, it's really difficult sometimes to feel comfortable finding the help. That's the truth, especially within the mental health world and even in the medical health world, right? there's not a lot of us that are considered minority within the mental health field. As you see, there's a majority of mental health professionals that are white. Very few of us, 25% of us, are not white. So I did come up with a list of resources that could be helpful. And there's a lot of things to consider, right, when you're trying to find a provider. And it's just a matter of normalizing those things. So when you're trying to find a provider, it's finding someone through their profile truly that aligns with who you are as a human. And so within these resources, it's narrowing it down. So the most common one I would say is Psychology Today. People have profiles. Within that, narrow it down. So I would say for myself, right? I'll tell you a little bit about me. So when I was looking for a therapist, because therapists see therapists, I think any good therapist would, is a matter of, okay, well, I want them to be able to speak Spanish because, I speak Spanglish quite often. There's things I can't say in English. It was important to me that, they were a little younger. I wasn't looking, or I was trying to find someone that would kind of understand who I am. I wanted them to be Hispanic. So you can start to narrow all those things down and further look into their profile, what they write, who they align themselves with, because they usually put that in their profile too, right? So if there's certain allyships that are important to you, you want to see that stand out as well. So there's a lot of different ways to find that. And if you need help, I'm open to helping find that person for you, right? Or answer the questions that you might need to get that person. So, all right, presentation is done. Happy to answer comments and questions. I know it was a lot. Hopefully you all found it valuable. I'm scrolling through the chat.
Thank you, Janelle.
No, you're very welcome.
We are close to time, but there is a question in the chat, and we will take one question from the floor if there are any before we allow our members to get back to their day.
Let me see. I'm scrolling through.
Yes,
Eh,
ask a question. My
Yes.
name is Salome. Right now I have a friend, a bit psychosis. She believes that she's being monitored, she's being followed, and she's scared. Even myself, and we've been friends for over 10 years. And she even left her job thinking that people just, are against her and wants her harm. But because she left her job, so now she doesn't have insurance. And the family, myself, people that loves her knows that, we know that she needs help. How can we, what is the best route to take when it comes to that? Because she doesn't have insurance, but she needs to see a professional.
I mean, that's difficult because it's hard when people don't necessarily want the help, but you see them so desperately needing the help. One of the first things that honestly comes to my mind is the mobile crisis unit, because they will come out to you. As far as I know, there's no cost associated with it. And it's licensed professionals that will come out to the home wherever the person is, and they can do an assessment. They can determine whether they need to just be connected to services or sometimes be hospitalized. So that's a really good resource. So in
So you
that
said
case,
mobile service unit?
it's the mobile crisis unit. What you
Crisis.
can do, it's much easier, is if you call 211. 211 is a community service. Here we go. Put it here. 211 helps with community services, so you can call them and ask to be connected with a mobile crisis unit.
Okay, thank you so much.
You're welcome. I wish you good luck. I know that's really difficult.
That is very hard when you love someone, you care for them, and you see
Of
that
course,
something is wrong and you cannot help, and it's hard.
it is. It is incredibly difficult, especially, you love and you care for someone, but they don't necessarily know in that moment that something is wrong.
Yeah, that is the thing. That's the hard part.
Mhm.
Yeah. All right then. Thank you.
You're very welcome.
Thank you. you.
Oh, Katie, I see a question from you. Are
Oh.
white providers getting trained on how to recognize mental illness on white patients, and are they receiving training on addressing the stigmas within non-white communities? There is a lot of training around multicultural sensitivity within our education and our training programs and all that. Now the problem is at the end of the day that people are human and people will still have their biases and their own personal beliefs, and that can come across sometimes in therapy, although we are taught not to, right? And so that's why I was putting up these slides, right? Like this is still at the end of the day really important, and I want to acknowledge it for anyone and everyone that's still choosing to go into therapy. The other side of it too is that, when some of these theories were created, theories being, everybody kind of uses a framework or a lens when they're doing therapy. When these theories were created, they were essentially based and researched on when it came to around, well, excuse me, let me take that back. It was researched and created around basically the white Eurocentric man, right? So, yes, we have these frameworks and we have these lenses in which we want to work from and create the change and assist people. But we also have to be mindful in which or where it was created and by whom it was created and for whom it was created, and make sure that we are not then impacting the person sitting across from us, right? We have to make sure that we're able to mold things so that we're not hurting the person and we're actually being conscious of who they are, where they come from, what their needs are, etc. I hope that that kind of answers the question.
Thank you.
Yeah, because, as therapists, a good therapist, I will say, should be able to take into account a person's life story and the nuances of their life and not just blankly apply whatever they learned in school.
Awesome, thank you.
Uh-huh.
Well,
I'm
this
happy
is
to.
very helpful. Thank you, Janelle and Paola. You all have hopefully you scanned the QR codes, you took note of the resources that are available. I think early on also, Baptist Health Team put their, the QR code. So, there's lots of resources available. You just need to access them, and we understand there are some real disparities that continue to exist. But we are grateful to the Baptist Health Team for sharing with us and acknowledging Minority Mental Health Month. So Baptist has been a partner with ours for some time, so we're very grateful. So I hope that you all have learned some, because at the Black Chamber, we believe that informing our members helps them grow the success of their businesses. So before you go, I do want to share some upcoming events. Next week, we have Open for Business, where we'll bring together some city leaders to give you tools on how to do business with the municipalities. That's July 30th. So check out our upcoming events on the website, but that's going to be a very good session, because we know that you all want contracts and opportunities with the 39 municipalities here in Palm Beach County. Also, we have a two-part small business workshop being hosted in collaboration with Palm Beach County Commissioner Bobby Powell. So that's helping you get certified so that when these opportunities become available, you're ready to do business. As one of our board members says, you don't need to be getting ready, you need to be ready. So that is August 12 and 19. So look out for that. And then on the 6th, we're celebrating National Black Business Month with our Tri-Chamber Mixer, where we'll be hosting with our neighbors from Broward and Miami-Dade. So come out, and all of these events that I'm mentioning are free to members. So if you're not a member, we encourage you to join. And speaking of that, I see some of our members. Congratulations to any member here that was nominated for our People's Choice Awards. We'll celebrate you all on September 2nd. So I'm going to leave it at that. You can find all of our events on the website, upcoming events. Ladies and gentlemen, thank you again for joining us for Wednesday Wisdom. I see we do have our president-elect, Javante Edmonds, joined us. Hi, Javante. And again, I want to thank Jasmine Bray and Tracy Thomas. Ladies and gentlemen, have a grand day.